it's still the #1 cause of preventable death and disability in the United States.
It's unhealthy, it's vile, and I don't like it around me.
It's an addiction.
Because I think it's disgusting. Disgusting, disgusting, disgusting.
It's been 50 years since the U.S. Surgeon General put out the first report on smoking, so that was in 1964. And back then, almost half adults in the United States smoked. And we've made great progress by reducing smoking rates down closer to 20%. But that still means 1 out of 5 adults is smoking.
The effects of smoking for your health, like how bad it is.
It's terrible. It's terrible.
And you still smoke.
Yeah, I do. That's the power of addiction.
It's definitely a detriment to good health, and it's expensive. It's dirty. It's polluting. You know, I mean, why would anybody? Nobody was born with a chimney, so why do we do it?
Have I ever smoked a cigarette? I have to be honest and say yes. When I was 15, I smoked for about 6, maybe 9 months. I started smoking probably because of peer pressure. I had a best friend who smoked. She was even younger than me. She smoked and it was okay with her parents, so we actually had a place that it was okay to smoke. And then I actually had a kind of awakening around it where I started getting urges to want to smoke, and when I got those urges, I realized I was getting hooked, and that's when I quit.
So as I started when I was in high school for no good reason.
I've been so sick that I can't even breathe and still smoked. Yeah, don't ever start. I started smoking because the kids that I was with smoked. That's why I started.
I was around smoking when I was younger, and it just kind of made me sick, and I hated it. So that's why I don't.
It's very unhealthy, so it's like,
Yeah, I don't like smoking. I never did. How did you quit smoking?
I just wanted to. It's the only way.
I've tried hypnosis, I've tried the smoking drugs, I've tried the patch, I've tried the gum, I've tried everything.
Because most smokers, if you ask them, have tried to quit in the past, but nicotine is such an addictive substance that quitting is very hard, and it requires multiple attempts to do it.
The reason why I quit smoking is so I can feel better, and doing the electronic cigarette helps you do that because you don't have all the extra added chemicals or anything in a regular cigarette.
I quit by taking a cessation class.
I decided that it wasn't good for me anymore, and I did sort of what they call now cold turkey, just immediately. And I actually got a bunch of my friends to stop also, for a while.
I feel really great about it. I quit 11 years ago, so 11 years smoke-free, yeah.
When I first moved here, Mom was like, "Oh, yeah, you can't smoke in town." I'm like, "Really? It's pretty cool."
I prefer that they keep their smoke to themselves and that they don't litter in the river.
So that way no one has to be bothered with it. Nobody has to have cigarette butts on the ground.
It's their decision.
It sucks to be them.
Yeah, you know, I mean, it's
In town.
Yeah.
Because I think it's an imposition when people smoke. It's an imposition on people who don't smoke, who find it disgusting.
Tobacco use affects not only the smoker as an individual themselves, but the people around them. And so since 1964, unfortunately about 20 million Americans have had premature deaths due to tobacco-related illnesses. 2.5 million of those were non-smokers who were just exposed to other people's smoke.
I know I don't like secondhand smoke, and so anything that's going to cut down on smoke that's going to be in a public area, I'm all for it.
It is a health issue of like clean air.
I mean, it's a small town, so maybe you know, because it's so restricted, maybe it annoys a lot of people. But I think it would annoy a lot of smokers not to be able to walk up down the street. But I've got mixed feelings on it. Mixed feelings.
Personally, I think people should be able to smoke wherever they want. I don't know.
Okay.
As an ex-smoker myself, I remember it being rather annoying, but other people have to breathe the same air, so.
Well, as long as the smokers do have somewhere to go, it's okay, but to tell them that they can't smoke anywhere, I think is a little bit fascist.
I think in downtown Nevada City and Grass Valley, it's the ordinance is not always being honored. We do see people smoking downtown.
People just have a hard time with change anyways, and so that's kind of a unique thing. So there's a little bit of resistance, and it kind of goes in waves.
Even though I think that smoking is really bad and people should not smoke, I do have issues with banning smoking in the open air. I think that we shouldn't be giving up our liberties so easily. Smoking's one issue, then it's going to be something else and something else and something else. You have to be very, very careful about the freedoms you give up, especially when you're outside in free air.
I think there's bigger fish to fry than going after smokers. But that's one man's opinion. Doesn't mean much, I guess.
However, since smoking is no longer allowed, my clothes smell better when I go home at night.
I think that the smoke-free policies in both Grass Valley and Nevada City really show that health is a priority here in Nevada County, both for the residents and just for the community in general.
But yeah, I kind of think it was a little lame how they just decided to do it, and there wasn't any kind of voting on it or anything.
Sure.
I thought that was a little lame, just like the democratic process. And I mean, who knows? I probably would have voted for it.
Yes.
But hopefully I can quit soon.
Our youth coalition was really strategic in helping the city become aware of smoke-free policies, specifically working with the smoke-free parks in Nevada City and the Coaliton Park. And from that work that they did in doing butt pickups and presenting to City Council, it really urged them toward being able to create a whole downtown smoke-free policy.
I enrolled a number of teen volunteers and trained them around tobacco issues, took them to conferences, took them to Sacramento where they could meet with legislators and ask for different policies to be put in place on a state level.
I was part of this youth coalition that went down to the Capitol and talked to our state legislature about the work we did regarding tobacco litter and smoking. We shared our successes about getting certain city areas smoke-free.
So I really feel that young people in our community had really shown that it was an issue to them, which got it on the radar for our policymakers.
Our county is just an amazing community of people that are really interested in promoting health for our young people and all of the rest of the community. So I think the smoking ordinances are good. I think we're moving in the right direction as we restrict the exposure that people would get to smoking.
I like that. I don't like smoke blowing in my face when I'm walking down the sidewalk. But I still see people smoke. I don't know if we can enforce that law.
People might know about it, but I think enforcement is an issue that they're having challenges with.
So I literally walk up and down the 3 main streets and the cross streets for the downtown area. Being that I'm the person out on foot, one of the difficult things about the smoking ordinances is that it's very simple and very easy to hide a cigarette if you're smoking it, so it's kind of difficult to enforce.
I think it is kind of harsh on people that are addicted to smoking. You gotta go find some corner to smoke in. It's a little hard to do sometimes. Oftentimes people just don't really follow it, especially at night.
In my opinion, I think the Nevada City smoke-free policy is very weak. I see the signs posted and I see people smoking right beneath them.
It is still fairly unique, and with our town, our signs kind of blend in pretty well with our landscape, so it's not really that obvious. I will give warnings, but if I am certain that I have given this person a warning before, or at least once or twice, then I go ahead and issue citations for the violation. Doing that, or if I walk up and everybody's hiding their cigarettes real quick, they clearly know that there's a violation there, that they're not supposed to be smoking if they're hiding it from me.
So I like the smoke-free zones. I don't think they're enforced well enough. I've noticed the enforcement's a little lax. But everything takes time. I suppose they're easing into it and whatnot, letting people get used to it.
Just trying to get more community support and more community involvement, getting business owners to maybe put signs in their stores and start adhering to the ordinances themselves, and just trying to get more people to hold everyone else accountable as well.
It's a challenge that there are a lot of community members really rallying around trying to find solutions. In fact, former Nevada City Council member Renette Senum is organizing some really wonderful community members in Nevada City to do something new. They're calling it Sidekick, and that's where members of the community would go downtown and sort of just kind of in the spirit of community and promoting health in their community, if they see someone smoking, they would ask them not to smoke and ask them if they knew there was an ordinance. And so, you know, that's a strategy that could prove to be really, really helpful.
And if someone's smoking in the street though, so what do you say? Do you interview people that say, yeah, I like the smoking ordinance, and when people are smoking around in the street, I tell them they can't smoke? Have you interviewed anyone that said that? Because I wouldn't necessarily tell somebody, oh, you can't smoke here, like outside.
I feel like the smoke-free policies in Nevada County have been really successful in bringing different community groups together in order to, you know, work together around an effort to make the community healthier. And I think that smoke-free policies in general really kind of reflect the overall goals of a community, and I think the smoke-free policies here really show that, you know, health is really a priority here for residents and for just the community in general.
When we look at the major causes of disability and death in the United States, cancers, heart disease, stroke, chronic lung diseases, they all have similar causes, and tobacco use is one of the main causes of that. And so I think we want to rally as a community to try to have more active lifestyles, better nutrition, and decrease tobacco use.
For the health of the environment, and also in the bigger picture that the cigarette tobacco companies are so huge that they had a face on the cigarette carton of how much money they make and who those people are and what they own. You wouldn't want to be contributing your money to those huge corporations.